key finding emerging from our study is that every year of education counts in terms of reducing the risk of mortality. Completing primary education has a risk reduction of dying by 13% compared to no education. The completion of secondary education has a risk reduction of 25%, and it jumps up to 34% if a person finishes higher education. More importantly, I think it's also the fact that education matters at all ages. What this means is, despite we finding a stronger effect in younger ages, it still retains a significant effect also in older ones. More education essentially lends better working conditions, higher income, better access to health care, and a stronger sense of control over our lives. This study is a systematic review of studies published in any world language in 6 major journal databases over the last 40 years. We were able to identify over 600 studies on the topic. To our knowledge, this is the most extensive review ever completed, although there is always room to improve. And one way to build on it would be to identify potential country reports from countries that were not covered in our study and whose reports were never actually published as academic articles. Education has a universal protective effect worldwide. What does this mean is that at every stage of socioeconomic development, more education leads to a reduction of risk of premature mortality. Unfortunately, we do see far fewer studies being published from low and middle income countries, and future research should focus on reducing this difference. Not going to school is as bad for your health as drinking 5 or more alcoholic drinks per day or smoking 10 cigarettes per day for 10 years. Education, in essence, provides a very strong protection to economic, social, health stressors that is comparable to the healthiest lifestyle one could live. Countries need to increase their investment in education in order to increase access and quality and to reach the Sustainable Development Goal by 2030. Such investment will not only pay off with a more qualified workforce, a higher labor productivity, and a strengthened social cohesion, but according to our study, it will also create a healthier population in the next decades.